Well, a lot of those changes in the healthcare bill are taking effect now, and they have an impact on your medical care. Andrew Rubin is the Vice President for Medical Center Clinical Affairs and Affiliates for NYU Langone Medical Center. He's also the host of Healthcare Connect on Sirius XM Radio. Andrew, good to see you. Good to see you again.
Good to see you too.
All right, let's talk about some of the changes that are going into effect. There are a bunch of them having to do with Medicare. Let's start with the donut hole. Tell us about what's happening with the donut hole.
This is the biggest one and probably the most confusing to so many seniors. The donut hole, as people know, is the portion of Medicare Part D where you lose your health insurance coverage for prescription drugs. Right now it's about $2,880 for this year. Starting on January 1st, anytime you enter that hole, which is from $2,880 to about $4,000 plus,
right,
half of the cost of the drugs you spend will be reimbursed by the government.
All right, and it's a different amount whether you buy brand name or generic. If you buy generic drugs, the discount is smaller.
It's a 7%, right, it's a 7% discount on generics and 50% of all the drugs you spend in the donut hole.
All right, very good. And this will increase each year after 2011. Let's talk about Medicare premiums, Andrew. Are they increasing?
They are. So what they did was for anyone making individuals making $85,000 or less, or couples at $170,000, they're holding the premiums for these are Part B premiums, the portions that you pay for doctor visits. Anybody who makes more than that, they're going to go up by about 4.4%.
All right, and there are also changes to preventative care coverage. This has obviously been a big discussion that we've had in the past. What changes with respect to care that you undergo to help you not get sick?
Allie, this is a big deal. Now remember, last year the whole conversation was about cutting fees, all physician fees, and that was fixed by Congress last year. This is basically part of the health care reform law that's designed to make sure seniors have access to primary care physicians. So there's a 10% fee enhancement for any physician who basically offers primary care services within their practice. And it includes surgeons too, as long as at least 60% of their practice is spent on primary care services.
That's an interesting development. All right, let's talk about stuff that affects everybody. What have we got there?
So, again, some big changes, and we've talked about these, and a lot of people like these. These are where children under age 26 dependent children get to stay on their parents' policies. That's a big one. Children can't be denied. Children can't be denied anymore for pre-existing conditions if they have that. There's some preventative screening services that are now covered. So if you're in Medicare, you get a free annual checkup. Free being defined as no co-insurance, no co-pays, no deductibles, and that applies to a lot of private employer plans as well. No co-pays for mammograms, colonoscopies, no co-insurance for those services. So again, some big changes that apply to everyone. The one that people don't like is you can no longer buy over-the-counter drugs from your flexible spending account. That was one of the downsides of the healthcare reform.
What, is there a difference there if your doctor has prescribed an over-the-counter drug? The doctor says you got to have this DM.
Exactly. So you know, Motrin, Advil. Sometimes you get a prescription strength of that. But if there's a prescription, then you can get that covered through your flexible spending account. Except most doctors tend to not do that.
Andrew, what do you do? What do people do when they were following the news about these lawsuits and changes that the Republicans want to make to health care? Should you just carry on as if nothing's changing?
Yeah, but for now, basically, what the big debate happens to be over right now is this individual mandate, which is where everybody's required to have health insurance, and that doesn't kick in until 2014. So the Supreme Court, what people heard in the news was the Supreme Court's going to have to decide this over the next couple years. Until then, health care reform continues as is. Now, Congress may try and block some of the funding for its implementation, but as of now, it continues as is, and nothing changes until 2014, when that's when you'll be able to buy insurance on state exchanges, sort of opening up the insurance markets, and there'll be the elimination of pre-existing conditions for people buying insurance. Andrew, good to see you as always. Thanks very much for helping us clear this up. Andrew Rubin is the Vice President for Medical Center Clinical Affairs and Affiliates. He's also the host of Healthcare Connect on Sirius Satellite XM Radio. Good to see you, Andrew.